Specialty Story, session number 99. Whether you're a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you'll want to practice. This podcast will tell you the stories of specialists from every field to give you the information to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome to Specialty Stories. I'm excited to have you here today. My name is Dr. Ryan Gray, and this is episode 99, one away from 100, which is awesome. This is our fourth podcast now that is into triple digits as far as episode numbers, and we're well over 5 million downloads for all of our shows. So thank you for being one of those downloads if this is the only time that you've listened, and multiple downloads if you have been a recurring listener here on the podcast. This week, we have an awesome guest, a different type of specialty, one that you may have never thought of before. We have a pathologist-trained blood banking transfusion medicine specialist, Dr. Aaron Shmookler, joining us today. He's been out of training now for a year and a half, and he's in an academic setting in West Virginia. And he talks all about what it's like to be a blood banking transfusion medicine specialist. And we start by what actually led him to that field.
So I would say that I fell into blood bank transfusion medicine a little bit late, so to speak. I had actually started a transitional year and started residency in neurology, actually. And what happened is that I realized that something was missing. And what was missing was the lab. I missed a lot of the basic sciences and the laboratory work from medical school. And I went into pathology, actually, really enjoying the field. But then I finished pathology residency and quickly realized that I also missed seeing patients at the bedside. So I subspecialized in transfusion medicine and blood banking, where the bedside aspect of care is the apheresis side, and also general non-apheresis issues, such as asking patients about their history and their transfusion history, for example, and the laboratory side, where I kind of work behind the scenes, playing games, so to speak, serious games, of course, but these are puzzles. That is the antibody panels, and making sure that the blood that comes out of my blood bank is going to be compatible when it's transfused into a patient.
Interesting. I think the majority of students, when they hear pathologist in general, will think no patient contact at all. What percentage of your time is interacting with patients as a transfusion medicine specialist?
It has varied. I did a lot more of it in fellowship because I was training more formally in apheresis. So when I was there, about half my time, I would be seeing consults, talking with patients at that point, and the other half just studying and looking at panels. Now it's a little bit less, although we are trying to bring up a little bit more apheresis opportunities here at where I'm working at. But still, I every once in a while will go talk to patients. So,
what traits do you think lead to someone being a good blood bank and transfusion medicine specialist?
I would say that, and this also goes for the general field of pathology, which is how I got to blood bank and transfusion medicine. Detailed oriented, very specific, and also concise, I would say. And I must admit, I sometimes struggle with this, but if you're, say, a pathologist and you're writing comments, especially surgeons, they don't want to read anything long. They want to know pretty much the essence of the synoptic reports. So, shorter is better and very detailed, and you can't miss really anything. So when you catch a lab result, for example, that is a little odd or unexpected, you better catch it, and you better question it to make sure that it is truly the right result.
Now, you're a rare breed, having changed specialties after matching. What do you think it was about neurology that initially drew your interest?
When I was in college, down the street from where I lived, there was a assisted living facility, actually, and I became interested in caring for patients who had Alzheimer's there, and I thought that that aspect of it was very meaningful to me, and just neurological diseases in general, localizing lesions. Was very interesting to me. And at the time, I don't think I was too shabby at it. Now, of course, don't ask me anything about that. But at the time, it was very interesting. And I really liked the neuroanatomy and the pathology and just interacting with those kinds of patients. And so that's sort of what drew to me initially to neurology.
Okay. As a blood banking transfusion medicine specialist, what types of things are you seeing, right? Pathologies are you seeing? What types of patients are you seeing as a transfusion medicine doc?
I would say that at the bedside, we perform a procedure called apheresis, which I describe patients as an oil change, where, for example, if you have a patient with sickle cell disease, these patients can be chronically dependent on blood transfusions. And one of the ways we can treat them is by exchanging their abnormal red cells and transfusing them with normal red cells. So that procedure can take about a couple hours, we'll say. But let's say you've got someone where the problem isn't with their red cells, but with their plasma. So if they have a neurological condition with some sort of antibody-mediated issue, or if you have someone with thrombotic thrombocytopenia purpura, TTP, often you may need to exchange these patients' plasma. So we will take out their plasma and give them back either plasma or albumin, depending on what the specific condition entails. And so there's a whole slew of guidelines put forth by the American Society for Apheresis that sort of gives an idea of what kinds of conditions that we would be treating. And so you can see the kinds of patients that we would encounter based on these conditions. In addition, though, given that I'm also in charge of all the blood products that we dispense in our hospital, whoever needs blood gets blood. So emergency patients who come in with traumas, surgical patients that are in the ORs that need blood because maybe something is going well, but maybe something isn't going well. Obstetric patients, we really touch everybody, I would say. Anyone who needs a blood product. That really comes through me. So it's a very ginormous responsibility.
Yeah, let's talk about that responsibility, because you're the first guest I've had on the podcast who is a blood bank specialist. What are you doing day in and day out? What are the roles of a physician in a blood bank?
Responsibility is to make sure at the end of the day that all blood products that come out of my blood bank are going to be compatible with the patient who is going to receive the blood product. And one of the ways we do that is we make sure that patients haven't developed any antibodies to some of the antigens that are on red cells. And if they have, then I better make sure that I find units of blood that would be negative for those antibodies so that they don't see those antigens and react to that, if possible. Sometimes we might not be able to work up a patient's antigen status, and as a result, we may need to release blood somewhat emergently. And we have to caution physicians who require that blood emergently that we haven't really completed all the testing we need to do to find the best matched blood for them. And usually that happens when the patient is bleeding significantly and they can't wait for any testing and they have to transfuse something. So we can give special blood for that, but we cannot guarantee that it would necessarily not cause an adverse effect. So we have to be mindful of those particular conditions. We also here in the blood bank manage factors. So say, for example, like prothrombin complex concentrate or Kcentra, and factors used to help treat patients with hemophilia. So factor 8, for example. So we actually manage that here as well and distribute that accordingly. And if we also make sure that the dose is appropriate, and if we're wondering about it, we'll talk with the clinician to say, why did you order this dose? And we come to understand why they do what they do and provide a recommendation to say, well, we agree with you, that seems appropriate, carry on. Or if we feel that we need to, or if we feel that we it may be too high or too low a dose, and we'll say, what if we kind of give it this way because we feel this might be a little bit better for the patient. And so, yeah.
Describe a typical day.
Typical day for me would be come into work, follow up on any patients that may have come in at night that have required maybe a significant amount of blood, or patients who have received certain factor products. We have to retrospectively review a number of products that we give out. For example, also irradiated products. And make sure that that's appropriate, or if it isn't appropriate, then we talk to the clinician to say to try to find out what the right reasoning was actually. And once I do all of that, we'll take some time to teach residents. I will also conduct research, and I also double not double. Part of my training as a pathologist, clinical pathology. So if I'm on service for electrophoresis, I'll interpret electrophoresis. If I'm on service for our hematology side of things, then I will read slides and interpret peripheral blood smears.
Are there any procedures involved with being a blood bank specialist or transfusion medicine specialist that somebody who wants to be working with their hands would like to do?
The procedure, I would say, is usually apheresis, or at least that's my exposure. And often that involves the help of a nurse to run a apheresis machine. And you're sort of overseeing all of this as it's happening. Not really otherwise other procedures per se, though we do often work with nursing, for example, to make sure that standard operating procedures, so that when we issue blood, the nurses are able to transfuse it in the right way. And we also have to oversee the procedures that our own blood bank technologists are doing, so that when they are performing all the laboratory testing, those procedures are being done correctly. So while not directly hands-on, we certainly are overseeing a lot of the procedures that other people are doing to make sure that it's going swimmingly.
What does call look like for you?
So I take about 6 to 8 weeks of call. And during that time, the residents usually field any calls that come from often the blood bank. As a clinical pathologist or as a pathology resident, a lot of the calls come from blood bank. And if there are any questions that they have, they can ask me about it. And usually, like I had said, it's mostly blood bank related questions, for example, blood bank related questions. Sometimes it could be other specimen related questions, such as Was the specimen received appropriately in the laboratory or not? Also trying to get a hold of clinicians who may have ordered the lab, but may have left for the day, and the laboratory is trying to get a hold of them and isn't able to get a hold of them to communicate the critical result. So if that's the case, then we try to get a hold of someone who would be able to take the results so that they could determine whether or not it is appropriate to, basically, the lab will communicate a result. And if they can't get a hold of someone, they'll oftentimes ask the pathologist on call to help relay the result, because it's usually a critical result, which is why we're calling, and relay it to a physician who would be more closer to the patient and be able to help address the result and figure out what to do next, basically.
What is the training path to become a blood bank specialist, transfusion medicine specialist?
So after medical school, you can do really whatever you want for residency. And there are certain residencies that may tend themselves toward wanting to become a transfusion medicine physician. For example, pathology is one route. And in fact, the board certification exam for blood bank and transfusion medicine is offered by the American Board of Pathology. Otherwise, patients who may be undergoing training in anesthesiology may be interested in transfusion medicine, also hematology oncology, maybe even emergency medicine as well, though typically pathology is the route you would go to, transfusion medicine, blood banking.
Is there enough patient load out there for someone to go from anesthesia to be a transfusion medicine specialist full-time? Or is that just an extra thing that people would do?
It would probably be an extra thing that they would do.
Okay. How competitive is it to match into transfusion medicine?
To transfusion medicine itself, not competitive at all, I would say. Since I trained as a pathologist, I had actually looked up some of the data from the results and data of the 2019 residency match. Mm-hmm. And to become a pathologist, actually, there were 924 applicants for 601 pathology positions, and about 95% of them were filled. So with nearly 3 positions for U.S. senior, about 93% of U.S. seniors who applied were matched. So
nice.
Really good odds of becoming a pathologist. And once you're there, you can kind of decide after that what you want to do. Transfusion medicine, not too difficult, I would say.
Yeah. As a transfusion medicine specialist, blood banking specialist, are there any other opportunities to subspecialize, or are you kind of at the end of the road there?
You can subspecialize in something else. You can subspecialize in really anything, for me, in pathology. Oftentimes, something that could go well with transfusion medicine would be, say, hematopathology, although they can be somewhat different. The transfusion medicine side of things is rather clinical pathology heavy. Hematology or hematopathology sort of overlaps in that a lot of it is all blood related. Otherwise, if you'd like to subspecialize in another subspecialty that's a little bit closer to clinical pathology, such as maybe microbiology or clinical chemistry, that could be done. But for now, I'm finding that what I'm doing is most enjoyable and needed, so to speak. So I would hope that I could continue on as a transfusion specialist from here on out, but I'm open to other opportunities as they see fit.
Do you see any negative bias towards the DO population out there?
Oh, on the contrary. Actually, there's been an increase in DOs that have been reported going into pathology. In fact, I can say that one of my co-residents from when I was a fourth-year resident, she was our chief resident. She was a DO and subspecialized in dermatopathology, which is really hard to get into. Mm-hmm. And she got into it no problem and has a really sweet gig. So I would think that there isn't really any negative bias against DOs.
I want to know if there's any special OMT training for tissue slides.
I'm afraid that if we were to massage the cells themselves, they might pop. But I like where your head's at.
Yeah. What do you wish primary care providers knew about what you're doing day in and day out, or is it something that you really don't interact with them at all?
Actually, on the contrary, we interact with primary care physicians a lot, and we also interact with general surgeons a lot. We as pathologists work with both doctors and patients. And what we do is we help the primary care providers select the most appropriate tests so that resources are utilized in a cost-effective manner without harming the patient. A lot of what we do as pathologists and transfusion medicine specialists in a way too, is we want to make sure that we're giving the patient what they need. And often tests are ordered abnormally. And for me as a transfusion specialist, what I really harp upon is whether or not the blood is being used appropriately. Often we give blood unnecessarily. For example, we want to order so much blood for somebody who may not necessarily need it. And there has been a lot of data to show that a restrictive transfusion strategy can be beneficial compared to a more liberal transfusion strategy. In other words, the less blood you give somebody, the better it can actually be in certain clinical situations. And I'm of the mindset that less blood is more. It's kind of funny where I'm a transfusion specialist and I hold all the blood products, but honestly, I don't like to give it out unless it's absolutely necessary because it's technically an FDA regulated drug. It is toxin, it is poisonous. There have been studies that have shown that a transfusion of blood is independently associated with increased mortality. And so it has to be utilized in the right setting. And while most of the time it is, often it isn't. And so my job is to help make sure that the blood that is being distributed is used appropriately.
Yeah, so that's good. Are there any special opportunities outside of clinical medicine for blood banking, transfusion medicine specialist?
Yes. Blood bankers, transfusion specialists can function as medical directors and other doctors of blood donor centers. So whenever someone wants to go and donate blood, there's usually a transfusion specialist somewhere behind the scenes making sure that the blood that is being donated is tested appropriately for any infectious diseases, processed appropriately, and then distributed appropriately to people who need the blood. So like hospitals, for example. Sometimes transfusion specialists can be more of a face to the public in terms of requesting need for blood donations. And as teachers, I can think of one particular example, the blood bank guy, Dr. Joe Chaffin, who is a fantastic transfusion specialist and really an educator. So outside, I guess, from the clinical side of things, being the educator of blood and blood products and teaching students of medicine, and I'm sure he does this with all his patients as well, really his donors too, helping along that aspect of it is something that we do. So,
what do you know now that you wish you knew before going into blood banking and transfusion medicine?
I wish I knew a little bit more about blood banking and transfusion medicine a little bit earlier. I wish I actually knew about pathology a little bit earlier. And I think what would have helped me would have been to do a post-sophomore fellowship in pathology, which many institutions offer between the second and third years of medical school, where you are doing nothing but pathology, and it's both anatomic and clinical pathology. And if I had known about that in medical school, I would have probably tried to investigate it a little bit more, and try to do it and see if this was more of a fit for me than something like, say, more heavily bedside medicine, neurology, internal medicine, something like that.
What do you like the most about being a blood banker, transfusion medicine specialist?
I like both the patient side and the laboratory side. These puzzles that we're trying to solve, where we're trying to make sure that these puzzles that we're trying to solve, where we're trying to figure out if a patient has an antibody to a particular antigen, and where we try to find blood products that would be compatible with them. It's very interesting. I really enjoy the teaching of it. And I would say all of that together is a very nice balance for me, and how I like to, it's a very nice balance for me.
What do you like the least?
So here's what I guess I would like least, that I think is important to know, to let our audience know. We tend to work behind the scenes, and often it does get unnoticed or is simply undervalued by administrators and even patients. Relatedly, I would say that pathology often does lack support and resources, or even basic facilities, compared to, say, more money-making surgical specialties. Lastly, I can say that as pathologists, the workload can get really busy. It can also result in slower than expected turnaround times, which of course can delay care. However, the job of the pathologist is to efficiently make the right diagnosis the first time around. Otherwise, haste makes waste, and could result in significant errors that can seriously harm the patient. So,
for someone who is interested in potentially going out into the community, what opportunities are there for blood banking, transfusion medicine specialists to go out into the community versus staying in an academic setting?
So as a straight up blood banker, transfusion medicine specialist, being part of a donor center would be very much out in the community. There, as a pathology trained transfusion specialist, you would be a pathologist practicing in the community, predominantly anatomic pathology, but with additional training in blood banking. You would address a lot of calls that you would be getting on call, and that would help you actually. And as a result, you could be put in charge of the community blood bank setting, or like the blood bank that's part of like a community hospital, for example, where you're taking call and performing the functions, like I said, predominantly as an anatomic pathologist.
Do you see any major changes coming to your field in the near future?
Yes. From transfusion medicine specifically, we're bringing back whole blood. So we used to give whole blood in the military, and we still do, but since World War II, we've developed the ability to provide more component therapy, which basically means that we're able to give someone only red cells if they only need red cells, only plasma if they only need plasma, or only platelets if they only need platelets. And that has a lot of benefits, but we are realizing that in, say, the trauma setting, whole blood actually has been very beneficial. And so we're bringing whole blood into the civilian world, so to speak. So I think that's actually really, really interesting. In the pathology side of things, since first and foremost I trained as a pathologist, on the plus side, there are a lot of hot topic advances in pathology, including artificial intelligence and digital pathology, liquid biopsies, and also next generation sequencing. These are just basically fancy technologies to supplement the microscope, which has been in use since the late 16th century, and honestly will continue to be used for the foreseeable future. On the negative side, though, I will say there is a physician shortage in the US affecting many specialties. Of course, pathology is no exception. I had recently read an article published in 2013 offering a predictive model examining some of the factors that are influencing pathology workforce supply in the United States. And what I had read was somewhat shocking, actually. Basically, in the coming 2 decades, it's projected that there will be a decrease from 5.7 to 3.7 full-time equivalent pathologists per 100,000 population. Retiring pathologists are anticipated to peak in 2021, so that's only a couple years from now. But we're looking at a deficit in the excess of more than 5,700 full-time equivalent pathologists, partially because of an aging population, and also pathologists are vital to providing access to laboratory services and impact providers' abilities to deliver more effective healthcare. So we need pathologists more than ever, I would say. So I encourage anyone from the audience who is interested in pathology or even remotely considering it, please look into it strongly.
For the technologically advanced, the technologically savvy, I consider myself one of them. I know that Google specifically, I'm sure there are many others, are working on machine learning to read slides. And obviously, it's going to be one specific thing that they can read for now, and then they'll add another thing and another thing. But it seems like in 10 to 20 years, machine learning is going to be able to replace or be an adjuvant or adjunct to pathologists reading slides all day, every day. How do you see that impacting the field in the future? Not necessarily the near future, because I don't think it's anywhere near prime time for the next couple of years.
Even in the near future, there's been great advances, I think, in this field. And I would agree that artificial intelligence would be an adjunct. I don't think it would ever replace the pathologist, because I don't think anything could come close to replicating the human eye, and let alone the human eye in its use of the microscope, which has been in use, like I said, since the late 16th century, and we continue to use it as the primary means of diagnosis. But I think if artificial intelligence is able to, in a way, help us, say from a digital pathology perspective, where we can, say, practice telepathology and have slides be put on the slides be seen by an artificial intelligent type of machine from far away and be able to project it so that we could see it from where we're sitting in our offices or our homes or wherever. I think that could be one way that it would be very useful for us.
If you had to do it all over again, would you still be a blood banking transfusion medicine specialist?
Yeah, I'd probably do that. I very much enjoy this topic in the field, and yeah, absolutely.
Any last words of wisdom for the medical student out there, maybe even the pathology resident who may be interested in blood banking transfusion medicine, to get them either interested in pathology or interested in them into subspecializing?
Yes. For one, of all the medical disciplines, pathology, I think, offers the most subspecialties. From the anatomic side of things, you can find a subspecialty fellowship in pretty much any of the organ systems, either systems or simple organ, say ocular, or if you want to do more gyn-onc, you can do that. So each of these different systems can be its own subspecialty for a year at least. And then there's the clinical pathology side of things, so like transfusion medicine, clinical chemistry, hematopathology, toxicology. So it's there are a lot of different ways you can function as a pathologist. And regardless, I would say, of whatever our audience members wants to do, I kind of think of medicine as like this journey on this expressway. So once you decide to start, there's a series of borders you cross toward reaching your final destination of being an independent and licensed physician. Accidents, of course, happen, and you may run into speed bumps. So alternative routes may have to be taken. So take care. So I encourage medical students and aspiring physicians to take care of themselves, make frequent pit stops, enjoy the scenery, and reflect on the vehicle that they're riding. So that vehicle contains the most important aspects. So books, sporting equipment, maybe a partner, kids, animals, whatever. So.
All right, so there you have it. Again, Dr. Aaron Shmookler in West Virginia talking about being a blood banking transfusion medicine specialist. It's very hard to say over and over again. Hopefully I didn't stumble. I hope you enjoyed this podcast today. I'm excited to bring you episode 100 here next week or in the near future. I hope you have a great week. See you next time here on Specialty Stories.
This is MedEd Media.